Hello, and welcome to my Lead What You Live podcast with Tina Lizzio. That's me. And I have, as always, a very, very special guest with me today. You're going to meet Dr. Jenn Simmons. She actually is coming to me from California. She flew to LA yesterday, and here she is with me from there. I'm in the studio here in Boca Raton, Florida. And Dr. Jenn Simmons is a breast surgeon. She's an integrative oncologist. She also is a podcast host, like I am, called Keeping Abreast. And she is the best-selling author of The Smart Woman's Guide to Breast Cancer. We'll see a cover of that. And without further ado, welcome Dr. Jenn Simmons to Lead What You Live.
Hello, my friend. It's so nice to see you
It
2 days in a
is.
row. What a special
I
treat.
know. I was just in New York City the last couple of days, and I get there frequently for work. And Jenn and I met less than 2 years ago, actually, at a global women club and other women's networking events, which is so great. And our energies aligned immediately. And it wasn't just because of her amazing red hair. She is so beautiful inside and out and what she is leading and up to in the world. And so it was an obvious that I had to have her as a guest. And I'm grateful because she's super busy with what she's up to. We're going to get into that she's taking out the time with her travels, like I said, to come on and speak with me for all of you. I am wearing hot pink today in honor of her and all things related to breast and breast cancer prevention and treatment and all that good stuff and finding cures. So tell us, you are a breast surgeon first and foremost, Jenn, and what led you to that specialty?
Well, first, I want to remind you of what originally drew us together as you were talking about wearing your pink. You were wearing a stunning red jumpsuit, and you know how much anyone who knows me knows how much I love clothes and love fashion. And you were wearing this stunning red jumpsuit, and I just had to know who you were.
Awesome. Yeah, I tend to like to do the whole red power, thing also when
I
I'm not
love you
wearing
in
black
red.
all the time. But yeah, I do love red as much as you
I
wear
love a woman
every
in red.
shade of pink. That's so great. You had a gorgeous hot pink dress on yesterday when you
I
were
do.
when you
I'm
were
always,
speaking.
always, always famously in pink.
I love it. I love it. And so, yes, our energy is aligned. And so, it's like law of attraction. We attract our
Hmm.
people. And
Yep.
sometimes you
Yep.
don't know exactly why. And then you sort of find out later as it evolves. So we are peers in age and moms and have children. I have gone through menopause in the past couple of years. So I've been through the hormonal changes. I
Oh
am
yeah,
somebody who has
that's a
done.
joy.
Yeah, such a joy. Got them balanced, thankfully. And we're going to talk about hormones. What is the latest in breast screening, breast cancer screening? We're going to talk about what Dr. Jenn believes about hormone replacement therapy and estrogen. Is it good or bad? And the importance of functional medicine,
Spoiler alert.
yeah, spoiler alert. And so all kinds of things on this journey that we're going to
Yeah,
go on.
yeah.
So where
But
do we begin?
you wanted to know why surgery and why I'm doing what I'm doing now. So, the why surgery is actually as growing up, I never intended to be a breast surgeon from like the smallest age on. What what happened to me was that I come from a breast cancer family. So growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She was beautiful, brilliant, larger than life, the queen of Motown sound in Philadelphia. And she was my hero. She wrote 54 hits in all, and her most famous song was The Greatest Love of All. So she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali, but it really received its acclaim in March of 86 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know because Linda died of
Mm,
metastatic breast cancer 1 month after Whitney released that song.
wow.
I was 16 years old and my hero died. and her life and ultimately her death gave birth to my life's purpose because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. And
Yeah.
so I did the only thing I knew how to do. I became a doctor. I became a surgeon. I became the first doctor in my family, the first fellowship trained breast surgeon in Philadelphia, and the first oncoplastic surgeon in Pennsylvania. And I did that really well and for a really long time. And I did it long enough for my aunt to be diagnosed and long enough for my mother to be diagnosed. And with all the writing on the walls, I'm about 15 years into my career. And I am probably one of the most high performing people you have ever met.
You
And
are.
I go from that to not being able to walk across the room because I don't have the breath in my body. And I have this intensive 3-day workup. And at the end of those 3 days, I find myself sitting in the office of my friend and colleague and physician. And he tells me that I need surgery and chemo and radiation and all these things that I say all day, every day without hesitation or reservation. And yet, when these words are coming at you, I can assure you they have a different meaning. And I was a very conventionally trained doctor. I did not know of anything else, but I can tell you that all I could hear in that time and space was a voice in my head. And you can call it God, and you can call it universe, and you can call it whatever higher power you ascribe to or don't. All I could hear was a voice in my head saying, "There's something more, go find it." And my doctor told me that I would die, just like I had told thousands of women before that. So please know that I don't fault him in any way. He was telling me exactly what he knew and believed to be true. And I went on a journey to heal myself. And ultimately, what ended up happening is I found myself and I didn't know I was
Mm.
lost. I was so immersed in the world of conventional medicine that I couldn't see anything else. And it was actually my own illness that opened up my eyes to the fact that there's so much more. And what we are so focused on in the world of conventional medicine is the tumor, is diagnoses, is illness. But if all you do is focus on illness, if all you do is focus on disease, that's all you're going to get. And in fact, what we need to be thinking about is where's the disease coming from? What is causing this symptom that you're trying so hard to suppress? What is driving disease? What is changing your microenvironment? Because breast cancer, all cancer, is a normal response to an abnormal environment. So, unless you figure out what is making that environment abnormal, what is shifting your chemistry from the chemistry of joy to the chemistry of stress, then you can't come back to the chemistry of joy, which is what fosters health and wellness. And so, I learned about functional medicine. I learned about root cause medicine. And I spent the next 3 years of my life healing, learning, training, and ultimately, on the other side of it, when I had come out with my functional medicine certification and completely realigned my purpose to be what I was actually supposed to be doing, which is healing people and not just cutting out tumors. Once I did that, it was a bell I couldn't unring. And I haven't looked back since. And I know that my mission is so much greater than that time that I was spending in the operating room with people. Not that that wasn't serving, because it was serving, but it was serving in such a limited capacity. And our conventional medical system is so limited. And what I want to do is so vast, it's so big, it's so infinite, because I want to forever change. And I am forever changing how we diagnose, how we treat, how we screen for, and how we prevent breast cancer.
Yeah, it's what you're up to is so big and
It
so
is big.
grand and
Yeah.
so important.
Yeah.
And as they say, God doesn't give us anything more than we can handle, that He knows that we can handle. Things do not happen to us, they happen for us. So being
Amen.
able to go in and say, okay, okay, God, or higher power, like you said, universe, like
Yeah.
what is the message?
Yeah.
What do you want me to know? What to do? What am I to do with this?
Yeah.
And
Yeah.
so that is how beautiful. And you are in remission, of course, obviously.
I am. Thank God. Thank God. Thank
Yes,
God.
of course, thank God. And so I know what's so interesting is my mother had been diagnosed. She was the only one in the family anywhere with breast cancer when she was 60, and she was stage one tumor, not in the lymph nodes, BRCA1 and 2 gene negative, single growth, and was told it was 98% estrogen positive breast
Yeah.
cancer. Okay.
Yeah.
And all the things
They
and
love
all
to
the
say that.
things that lead to that. And I
Hmm.
remember sitting with her and going with her, and she's only 18 years older than I am. She had me young. I'm the firstborn, and I'm with her, and she's 60, and she's got this diagnosis. She found it herself with a front enclosure bra and realized, oh gosh, I haven't gone for my mammogram or
Oh,
my, test. And it
wow.
had been 18 months. So they
Wow.
wanted, boom, 4 cycles of TC chemo and 30 something radiation treatments. And it's like
Yeah.
the one size fits all protocol. And she said,
Yep.
I had the growth cut out. I'm not doing chemo. I'm hesitant to even do radiation, to be honest. She did it, regrets that. Nonetheless, I'm grateful. It's 14 years later. She's well, but she went through that protocol, and I'm glad that she said no to the breast cancer, to the chemo rather. And it again, not in my family everywhere. And so, what do the gynecologist and doctors want to tell me and my sisters? Oh no,
You're high
you're
risk.
high risk. You better do it every
Hmm.
6 months, and you need MRIs and MRIs with contrast in addition to your mammogram and your ultrasound, and you have dense breasts and all this stuff, right? To scare you.
Yeah.
And so I absolutely align to functional medicine, looking at root cause. I am a true believer that it is that external environment. We all have these cancer cells that may or may not ever be turned on, and it can be the stressors, the internal and external circumstances and
Yeah.
stressors that actually trigger it. And so, what I care about, and as a life strategist and working with people and finding that balance in the trifecta of your health, your wealth, and your relationships, meaningful relationships, is going to determine the quality of our life experience. And in particular, my number one value is health and wellness and longevity, especially since I crossed over that half century mark. And it's when after I turned 50 and was going through the hormonal changes and, raised my 3 kids, it's like, what's next? And so I just so appreciate that you are, and grateful that you are taking this on. And given your background, and you're just a perfect person to do that, and how I can continue to support you in that effort. Like, I'm there.
Well, thank you. I'll take all the help I
Yes,
can get,
absolutely. And
especially because,
tell us
I
what's new.
I
Yeah,
picked some big mountains to climb,
you did.
right?
You did it.
I picked some big mountains to climb. And the two things that I probably focus on most, which are the least accepted by establishment, is how we screen for breast cancer and how we treat breast cancer, especially with regard to what we do with people through treatment and then after. Because you said a couple of things when you were first talking about your mother's experience and that she was given this diagnosis, right? She has ER positive breast cancer, and there's so much fear around estrogen. And it's very intentional, right? Create the fear so that people think that they are reliant on someone to heal them, someone else, right? And they take your control away, right? There's
Yes,
nothing you can do. We have to do this for you. And if you make estrogen the villain, then we can sell you estrogen blocking drugs,
that's right.
right?
For 5 years.
And for 5 years. And if you understand the natural history of breast cancer, you'll know that 5 years is a meaningless amount of time. Meaningless. And so what they do is they give you these drugs over 5 years, and they say, see, the cancer didn't come back. And then they kind of say goodbye to you because they say that you've been cured after 5 years. But the truth is that 5 years is nothing. Like if someone told you that 5 years is survival and you're 50, I'm not going to guess how many 50 somethings you are,
Yeah.
but you're 50 some years old.
56. Yeah.
Like 5 years, that's survival,
Right.
right? And we're not even saying this just to 50-year-olds. We're saying this to 40-year-olds. We're saying this to 30-year-olds. It's insulting.
Absolutely.
And what happens after these hormone blocking drugs, where we're celebrating for the fact that the cancer didn't come back during the 5 years that they were on these drugs, cancer wouldn't have come back anyway,
Anyway.
right? But what happens to these women is that when you block estrogen, estrogen is the hormone of life. Estrogen does not cause breast cancer. If we really believed that estrogen caused breast cancer, how do you explain the fact that breast cancer is far more common in the postmenopausal population than it is in the premenopausal population, right?
Correct. Yes.
Estrogen,
When the estrogen is dropped
like
and you have less,
immeasurable,
and now you have
immeasurable.
less. Right.
When people like me who measure people's hormones in the postmenopausal woman, you can any estrogen, barely, right? And yet, this is when breast cancers are far more common. And if estrogen were truly causative of breast cancer, why don't we see breast cancer during the times when estrogen is abundant, like teenagers, like pregnant women who have 10 times the amount of circulating estrogen, right? And the reason that we don't see it is because estrogen is protective. And the reason that we're seeing more and more breast cancer at younger and younger ages is because of estrogen dysfunction, because of deficiency, because of hormone deficiency. We're seeing earlier and earlier progesterone deficiency, and that is presenting as menstrual cycle abnormalities, as infertility, as things that we call estrogen dominance. Estrogen dominance isn't more estrogen. Estrogen dominance is less progesterone, is too little
Mm.
progesterone. And progesterone is extremely protective. And people don't know that. And especially, it's included in that narrative, right? Your tumor is ER and PR positive, estrogen receptor and progesterone receptor positive. So people think that estrogen causes breast cancer and progesterone causes breast cancer. It's simply not true. Normal breast cells have estrogen and progesterone receptors on them. And so I work really, really hard to dispel this nonsense, because if you buy into it and if you go through conventional treatment and 5 years later they tell you you're cured, and they're not thinking about and not worried about what the ramifications of that treatment are, of that one size fits all treatment. Because when you block estrogen, you accelerate heart disease, you accelerate brain disease, you accelerate bone disease. These are the major causes of death in women. And most women who get breast cancer do not die of breast cancer. Most women who get breast cancer die of cardiovascular disease.
Yes.
And
Heart.
that's part and parcel due to the fact that, first of all, most women who get treated for breast cancer never think about root cause, because they're never told to think about root cause, and they never get to the root of the problem. They never eliminate the root of the problem. And therefore, they just go on to the next manifestation of their illness, which is cardiovascular disease. The other thing is, almost all of the treatments that we use for breast cancer right now accelerate cardiovascular disease. So we're actually adding to the disease that is the number one threat to a woman's life. And even looking beyond that, at bone disease, at osteoporosis, when you take a woman's estrogen away, that's what's protecting bone health. And lest we forget, this same exact number of women die every year as a complication of a fracture as due of breast cancer.
I heard a
We
crazy
can't.
statistic on hip, like if you fall, for women who fall, if you break
Yep.
a hip or need a hip replacement, life expectancy is dramatically reduced.
Yep. Especially within the first year of that fracture.
Yeah.
So the problem to me is that we are so siloed that the medical oncologist is thinking about those 5 years of getting you through treatment and safety, but not thinking about what your life will be like afterwards. The radiation oncologist is thinking about getting you through radiation, but not thinking about what your life will be afterwards. The surgeon is thinking about getting you through surgery, but not what your life will be afterwards. And no one is thinking about, what does longevity look like for this woman? What does survivorship look like for this woman? And how are we going to help her to restore her health? And these are conversations that are not happening inside of conventional medicine and need to be happening, because what we are leaving women with is not life.
No,
You know,
it's
we tell these women, it is.
taking
We
life
tell
force
these women
away.
that they should be grateful to be alive, and they are grateful. But it is very hard to feel grateful when you can't think, you can't sleep, you can't remember your words, you're depressed, you're anxious, you're scared, you have palpitations, your joints ache, your muscles ache, everything aches. Your breasts are deformed or absent. Your body just doesn't feel like your body. You've gained weight. You have no libido. Sex is unwanted and painful. Your relationship is either damaged or absent. I mean, it's really hard to feel grateful when all of this is happening. And yet, this is how we are leaving survivors. They are not thriving. And a lot of that is because no one ever helped them to understand why. No one ever helped them to restore their health, and no one ever helped them to restore their hormones. And that is what it is about in the end. Now, I am not saying that hormones are some miracle cure. They're not. They need to be done in the context of eating a nourishing diet, moving your body, prioritizing sleep, detoxification, um, creating a non toxic environment, living a meaningful, connected life. That is all very, very important and has to go along with it. But the bottom line is that hormones are, in fact, the they're essential for life. And so I am one of few people who are talking to breast cancer survivors about hormone replacement, not done in isolation, not done if you're not willing to make the other changes, but done in combination with all those other things that we know drive health.
I would have to ask a question. And again, The Smart Woman's Guide to Breast Cancer. Grateful that you published that too. So a lot of what Dr. Jenn is talking about, you'll be able to find and go more in depth in her book.
Yeah.
Is that is there a bad estrogen in this estrone I hear about? Like, is an excess of estrogen, if there are other conditions, can create an environment of bad
So
estrogen?
I think it's much more about how you detoxify your estrogen. That's part of it. And the other part of it is that progesterone deficiency is a problem. And if estrogen is a pro growth hormone, progesterone is an anti growth hormone. And so they need to be together. And it's very important to know what your estrogen levels are. Are they being balanced by progesterone? And how are you detoxifying your hormones? Because this is very important. And for me, when I work with people, everyone who comes into my breast cancer group, the Breast Health Blueprint, they get a nutritional genomic evaluation where we are looking at exactly how they detoxify their estrogen, and we're
Metabolize,
giving
sort
them.
of metabolize
Yes.
and detoxify, right?
Yes,
Yeah.
yes, because what happens is as you break down estrogen, you actually create some toxic metabolites. And some people create very little in terms of the toxic metabolites, and some people create a lot. So, for the people that create a lot, they need support on how to get rid of those toxic metabolites, how to properly detoxify and safely detoxify their estrogen. And there are different places and different ways to support them. So, it's important to know what everyone needs. This is where the process gets really individual.
And why functional medicine and not just traditional Western medicine, gynecologist. Um, I've always loved the female gynecologists that I've gone to. And yet at the same time, it's like, well, Tina, we need your mammogram and ultrasound. And it's been a while since your mother had breast cancer that you didn't do an MRI. But now we have a 3D mammo with contrast, so it's replacing the MRI that you can do and all this stuff. So I want to get
Yeah.
into what's really big is
Yeah.
what is new in breast cancer screening and an alternative to having my tits smashed between a plate and what comes out of that, the
Yeah.
negative
Yeah.
consequences
I
behind,
know.
radiation for women. So please tell us what is new.
They just keep putting lipstick on that pig, don't they?
Yes.
I mean, it is just astounding to me. I think we first have to back up and look at the facts, which we have known for decades, which is that mammograms do not save lives. And I always get a lot of backlash from people. Well, mammogram found my tumor, and so mammogram saved my life. People need to understand that that is not the same thing. And we have many, many studies which prove that mammograms do not save lives. So, just looking at the Swedish trials, 600,000 women, where 300,000 underwent mammographic screening, 300,000 underwent self breast examination. The same exact number of women die of breast cancer in each group. And the only difference between the groups are if you screen with mammogram, there are 20 to 30% more cancers diagnosed in that group. That was all comers. They didn't separate according to age or stratify according to age. But maybe thinking that if you look at young women, maybe there's an advantage for young women. So the Canadian breast cancer screening trial looked at just that. 90,000 women, 45,000 screened with mammogram, 45,000 did not. And the same exact results, the same exact number of women die of breast cancer in both groups. And if you screen with mammogram, you will diagnose 20 to 30% more breast cancers. So mammogram is not saving lives. And if it were saving breasts, that would be worth something at least, right? But when we look at what happened with mastectomy, it only increased in using mammogram to screen. Because when we use mammogram to screen and we find all of these things that are not meaningful, we create a lot of fear, and women choose to have mastectomy. And maybe it's a lot of the doctor influence as well, because fear is such a tool that is being used inside of conventional medicine. But women have mastectomies 20% more frequently when you use mammogram to screen than if you don't. So, my objection to mammogram is on so many levels. I mean, first of all, it's radiation. And the proponents of mammogram who go around saying, well, there's radiation everywhere. Yes, that may be true, but the scattered radiation that's everywhere, including at the airport and on an airplane and all of that, or just everyday background radiation, is wholly different than the focused cone down radiation that you get to the tissues of the breast during mammogram. So they are not the same. And the amount of damage that mammogram is capable of having is completely different and exponentially greater than background radiation. The compression, I mean, yes, it's trauma. And if it were just about pain, okay, we're women, we can do hard things. But the combination of radiation, of pain, and of the facts that we are not saving lives, and the more mammograms you have over your life, the higher your risk is of getting breast cancer. We are creating the very disease that we pretend to want to prevent
Prevent.
or help with, right?
Yes.
And it it is it is very much designed for the success of the system and not for the protection of the patient. And when we just do more with this same study, when we're talking about higher resolution or when we're talking about adding contrast, we are just looking harder for breast cancer. We do not need to look harder for breast cancer. We are picking up lesions that would have never presented in a woman's life, that would have never become clinical disease. And when we do that and we give a woman that label, we change her forever. When we put her through the tragedy of breast cancer treatment, we change her forever, and we decrease the quality and the quantity of her life. So these women that think that their lives were saved by mammogram, they're wrong. Mammogram is not having any effect on saving lives. And no matter how many mammograms we do every year, the exact same number of women die of breast cancer. No matter how many mammograms we do every year, the exact same number of women present with advanced disease. No matter how many mammograms we do every year, we still have the same number of women with aggressive findings, with aggressive disease, who are dying of breast cancer. We are not affecting that bottom line at all. And all we're doing is creating more disease, creating more anxiety, creating
More
more
insanity.
ultimate, yeah, but
More insanity.
ultimately more deaths from breast cancer. Because even though the deaths won't be attributed to breast cancer, if we're causing more heart disease, if we're causing more brain disease, if we're causing more bone disease, these women are going to die prematurely of those diseases. And it's not because of anything other than it was accelerated by the treatment of their breast cancer.
Which
So,
leads to
yeah,
the
what
where
should we be
what
doing?
should we be doing? And by the way, thermography. I hear about
Yeah,
this. I've never done thermography.
yeah. I
Could
mean, listen,
do you speak
thermography
into
is
that?
perfectly safe. So there's no danger to doing thermography, unlike there's danger to doing mammogram, there's danger to be doing MRI because MRI uses gadolinium, which is a heavy metal, which your body then has to detoxify, and over time it will cause end organ damage. But thermography is perfectly safe, but it is not a screening tool for breast cancer. It's not reliable enough. And I just don't use it as a screening tool for breast cancer. But let me tell you what I do and
Because this is
why I
big.
do it. Yeah,
Yes.
because the first thing is, and this was our vow, our very first day of medical school, right? First, do no harm. I do not believe in exposing healthy women, and that's what the screening population is. I don't believe in exposing healthy women to danger, right? So everything that I advocate for in this is 100% safe. So first of all, everyone should be doing self-breast examination. No one is ever going to know you better than you know yourself. And every woman thinks her breasts are lumpy. We just need to own our lumps. So if you are premenopausal, you're going to examine your breasts on day 7 of your cycle. If you're postmenopausal, you're going to feel them on the first. You're going to look at your breasts and you're going to feel your breasts, right? And if you know your breasts, you will know when something's changed. And so then go have an evaluation. The second thing that I advocate for is something called the ARIA tears test, where you are taking a small piece of paper and putting it in the corner of your eye, closing your eye for 5 minutes, sending that paper off. And a week and a half later, you get the results of either it's normal and you have nothing to worry about, or there's a clinically significant result. So let's talk about what that means. The ARIA test, the tears test, is looking for two proteins. These are
How are you
inflammatory
spelling that,
proteins,
Aria?
AURIA.care.
Thank
And
you.
I will give you my code. It's Dr. Jenn 20, DRJENN 20. That will get you 20% off. This is a very affordable test.
Self-test.
Yep. Self-test,
Thank
do it
you.
at home, takes 5 minutes. Okay. So a clinically significant ARIA test means that we found these two proteins in your tears at critical levels. And if you have breast cancer, 93% of the time, this test will predict it. If you don't have breast cancer, there are still going to be some positive results, some clinically significant results. That will happen 42% of the time in people who don't have breast cancer. However, I want to be clear, there are no false positives of this test. And if you have a clinically significant ARIA test, you have the inflammatory precursors to breast cancer. And if you do nothing, if you keep doing the same thing as you're doing it right now, 11% of people will develop clinical disease within the next 6 months, and another 11% 6 months after that, and another 11% 6 months after that. So, a
Even if you're
clinically significant,
negative for breast cancer specifically, there's an inflammatory precursor there.
yes, yes, the stage is set. The stage is set.
Yeah.
And so, what you can do is you can read my book, The Smart Woman's Guide to Breast Cancer, and try to figure out where that inflammation is coming from. And you can do things like I have a breast cancer prevention program and help to understand what is happening in your environment that is driving these inflammatory changes and do what you need to do to prevent a diagnosis. And this is truly an opportunity for prevention. Now, we have been so trained to image. I think if you have a clinically negative ARIA test, that you don't need imaging. I think that tests like the ARIA test, which will be knocked off time and time again because it's a very simple test, I do think like tests like the ARIA test will be the determination in the future of who does and who does not need imaging. But right now, we're so trained to image. And I truly believe that if we are going to image people, especially the screening population, we need to make sure that that imaging is 100% safe. We cannot put women, healthy women, and healthy breasts in harm's way. So the imaging that I advocate for is called QT. And I have the QT imaging machines at my centers called Perfection Imaging, and Perfection is spelled with QT in the center. This is sound wave technology transmitted through a warm water bath. So, in a 20-minute spa like procedure, a woman gets a true, painless, radiation free, transformative experience and a 3D reproduction of her breast,
Wow.
right? So, this is really reinventing how we are screening for breast cancer. But notice that I did not say to do that alone. I don't believe in imaging alone. I believe it needs to be done with examination. I believe that it needs to be done along with the ARIA test, the ARIA tears test, and some kind of safe imaging. If you don't have access to Perfection Imaging, there are a couple of other QT centers around the country. And if you don't have access to QT, then ultrasound. But I do not believe that anyone should be in harm's way for the purposes of screening. I do not believe in screening mammogram. I do not believe in screening MRI. Now, I want to be clear about something. I am talking about the screening population. This means that you have no reason to believe that you have breast cancer. If you have a symptom, if you feel a mass in your breast, if you've noticed a change in the appearance of the breast, if you have an inverted nipple, if you develop nipple discharge, if something is changing in your breast, you are no longer in the screening population. This is the diagnostic population. For diagnosis, you need to speak the language of the providers. Breast surgeons don't know how to interpret QT and will not accept it as proof of anything. They are going to require a mammogram, they're going to require an ultrasound. And in this instance, in the diagnostic population, that's okay. That's okay. We do what we have to do to make sure that we're okay. And if you're symptomatic, that is a sign that your body needs more attention. But in the screening population, where you have no symptom and no reason to believe that you have breast cancer, you should not be putting yourself in harm's way.
And it's recommended
Self-breast
for women like
examination.
over 40, like, so you can be doing this, you're
Well, it's
70, you've done it for 30
100% safe.
years.
So if you
No, I
if
mean,
you
I'm
are,
saying for suggesting the screening population, it's recommended that women start screening when? Over 40? I
it
think I was
mostly
recommended to me at
depends.
like 40.
Yeah, it mostly depends on your family history and your own personal risk factors, right? But if we really look at the guidelines are not to screen until you're 50. And the guidelines were originally built respecting the fact that mammograms are radiation
Right.
and you are taking on a risk every single time you have a mammogram. That's why the guidelines started at 50 and were recommended every other year. And we just took it and ran away with it because we figured, we counted on the fact that if they're telling us to do this, it must be safe, right? But in fact, there are no studies to show that mammograms save lives, that mammograms are safe, done annually, and there are some people that are getting them more than once a year, right? This is not
Yeah, if
safe.
you're up, it's recommended to me because my mother had breast cancer that I should do it every 6 months. I
Yeah,
said no,
yeah, yeah.
and
And
so
this
at a
is the
minimum once a
surefire
year.
way.
That you don't have
Yeah,
anything, it's once a year,
yeah. This is the surefire way to guarantee that you get breast cancer.
and you get this patient from 40 on for life.
Yep.
You know, this the
Until she
medical,
develops her disease, right?
right,
Until she develops her disease.
which
And
can,
then after the disease, we just image them more frequently so that it comes back.
again, the insanity wheel, the insanity wheel.
Mhm.
Uh,
Yep.
uh, you are working towards getting these perfection imaging
Everywhere. Yeah.
everywhere.
Yeah.
Yeah,
I have plans to
we
open up
need one
50
here
in
in
the next 5
yeah.
years.
That's amazing.
Oh, it's coming your way, my dear.
That's
It's coming your way.
that's so amazing. It's so
You'll
amazing.
have one
That's
in
like
your backyard very
revolutionary.
soon.
It's revolutionary. And like you
Yeah.
said, it's a transformative experience with the sound
Yeah.
waves with water and how that detection is
Yeah.
and
And, for women who come and have this test, we have taken the fear out of breast cancer screening. We have taken the pain out of breast cancer screening. And they're having this experience, which is so diametrically unlike what they've had in the past. And I think that's important because all of that fear, it adds up. Right? And if you're causing more and more fear over time, that is creating a hostile environment. And we need less hostility. We need to replace that with love and caring and gentleness and all of the things that we know drive health.
Absolutely. One last question before I let you go, because I know how busy you are, and there needs to be a part two because I have so many questions. And you're just a wealth of knowledge, and your own personal experience and journey adds so much wisdom, and to what you're bringing forth also with the perfection imaging with the QT. Breast breast implants. So plastic
Yeah.
surgery. You said we're in a world of aesthetics. It's expanding. More and more women. I don't have them, but many women, put in breast implants for aesthetics purposes.
Many.
And so, for those who do have them, then also, I imagine this type of screening also serves that. Because you
Absolutely. I
all.
mean, this screening, and I want to be clear,
I
I did
have
not
friends that
invent
have
this
ruptured
screening.
their, implants from doing the
Yeah,
screenings
from
as a
mammograms.
side
Yeah,
effect.
yeah, absolutely. I didn't invent this technology. It was invented by Dr. John Clock. He is a genius and he is my hero and my mentor. Um, this technology was originally invented on an NIH sponsored grant, a $20 million NIH, National Institute of Health sponsored grant, to solve the problem of screening women with dense breasts or implants or high risk, because MRI is the gold standard right now. And MRI is very problematic because of the gadolinium, which is a heavy metal,
Yes.
because it's expensive, because it's uncomfortable, because there are access issues. I mean, there are so many reasons. One of my biggest objections to MR is that it is so sensitive that there are so many false positives with that test, for which people get unnecessary biopsies, unnecessary surgeries, even mastectomies because of false positives with MRI. So, John Clock was asked to solve this problem with QT, and he did. And he did.
Amazing.
So, this is an excellent technology for screening women with implants. But I do want to say something about breast implant illness. I don't remember the exact numbers, don't quote me, but I think 400,000 women a year have breast implants placed. I need to check that statistic, but I'm pretty sure that's
It's
what I
growing.
remember. Yeah. Um, breast implant illness is very real. We are not meant to put foreign bodies inside of us. Remember that that breast implant is encased in plastic. So, at the very least, you're exposed to plastic every single day, day in, day out for years and years and years. People do develop predictable um, symptoms of breast implant illness. They are different for everyone, but people complain of brain fog and inflammation and swelling and weight gain and digestive problems and joint aches. And some people get better when they remove their implants, some people don't. But if all you do is remove the implants and this is a toxin issue, which that's what breast implant illness is, it's a toxin issue. If you don't do anything to detoxify, you're not going to feel better. I'm really not an advocate of breast implants ever. I'm really not an advocate for women who have mastectomy and have implant reconstructions, because they've already proven that their body is struggling with toxins, and then we're putting another permanent toxin in their body. At the same time, I believe that everyone who has to undergo the trauma and the pain of mastectomy does deserve a reconstruction, and not everyone is a candidate for tissue reconstruction. So I think that population is especially challenging, but all the more important to have all of your detoxification practices in place and to create an environment where you're really minimizing your toxic exposure. So I think breast implant illness is very real. I don't know that everyone develops clinical symptoms, but I think that everyone gets an increase in their toxic load and an
Yes.
increase in
Many are
their
doing
toxic
explants
exposure.
now as a result. That is real.
Yes.
Yeah. Many
Yes.
women are getting
Yes.
the explants.
Yes.
And
It's
so
very real.
all of these things, including conversation around the detoxification, is in the Smart Women's Guide to Breast Cancer.
It
Show
sure
us that
is.
again.
It
And you
sure
heard
is.
what she said in terms of the Dr. Jenn, Jenn 20 for your discount, right?
Yes, for aria.care, AURIA.care, and use the code Dr. Jenn 20, DRJENN 20, to get 20% off of the ARIA test. And again, screening should be safe, it should be painless, and it can be if you're doing self-examination, the ARIA test, and either the QT scan or ultrasound.
Jenn, thank you so, so much for joining me today. And I just appreciate so much. When I can, I am always a yes and fit things in. And so I appreciate you being a yes to being on Lead What You Live. And you can continue also to follow Dr. Jenn Simmons and her podcast, Keeping Abreast, and you can find her there, and definitely get a copy of her book. It is packed with really powerful and important information, and then share it with another, pass it on to another woman, to a friend, to family members. We all need to get this information out there. And so, to be continued. I don't say goodbye, I say to be continued. I love you and thank you again for being a guest here, and safe travels. And I
Thank
look
you.
forward to seeing the screening here, and however I can support you in that effort to expand across the
Amazing. Well,
country.
it's so,
All right.
so great to be here with you today.
Thank you, Jenn. Ciao for
Bye.
now.